Sisters Hospital in Buffalo is putting a focus on expectant mothers, their health, and of course their baby's health.
To talk about this new program, right now we are joined by Hospital President Megan Aldrich and Shannon Johns with Calming Nature Doula. It is a pleasure to have you two here. Thank you so much for coming in.
Thank you for inviting us.
This is a very wonderful announcement that was made. In case anyone missed our coverage yesterday, tell us about this special program.
Sure, happy to. Do you want to start with the doula side?
I will start. So the program is for high-risk moms. Provides moms with doula services and support throughout their pregnancy, during the time that they are in labor, as well as once they go home with the baby.
How important is it to have a program like this that is accessible for people in the city of Buffalo, and I would imagine beyond?
Absolutely. Yes. Having a program like this is incredibly important. As we know, there are disparities in the outcomes for women for a multitude of different reasons, whether it's socioeconomic status or their race. And so Sisters and Catholic Health is really dedicated to addressing these disparities. And so the Maternal Health Equity Center is a key piece of addressing those issues, and Shannon and her team at the Doula Center have really been an amazing partner.
You mentioned high risk, right?
Yes.
Using that word. Elaborating on what those disparities are. What are a number of these mothers faced with?
So some of them are faced with high-risk conditions around their health. Some of them are faced with conditions around socioeconomic statuses, their zip code, their race, their income, their education level. There's a multitude of things that consider someone high risk, but all of those factors play a role into their health, their outcomes, but also to their perception of what they should be expecting as far as care.
I think that also is one of, and maybe just some of the reasons that you just laid out. Those are some of the reasons that people of color, oftentimes women, are fearful of our healthcare system. And I feel like a lot of people, unless of course you are maybe a person of color or a woman person of color, you really don't realize that that is a very real barrier for people.
Yes.
And that's because the data backs it up. These are facts. These are not someone making up some idea. There are actual disparities. These are the data. It is raw. And I think having a center like this, it gives someone the idea that not only is it available, but all of a sudden this is different from what perhaps this part of our population has been dealing with.
Absolutely. I will say if you consider the African-American population and culture, historically there has been a lot of distrust. There's been a lot of misinformation. There's been a lot of lack of information. So if you take back from, let's say my grandmother and then her grandmother and her grandmother, the information that was received wasn't always quality information. It wasn't always truthful information. So there's that lack of trust has just been passed down. Just be very cautious. So when a mom does express her concern or express that she has pain or has a fear, she doesn't know what she's going to be met with. She doesn't know what the response is going to be, or if she's actually going to truly get support or help. So that's what the center kind of comes in and steps in and says, okay, we really truly are here to help you and serve you. So if you let us know what the issue is, we're going to make sure that you're taken care of.
Because the trust is everything. It really is, both to the mothers and the babies, the entire family. So there then comes in the doula navigator, right?
Yes.
What kind of roles come with that?
So doula navigator is essentially just this individual's doula. So they provide information on pregnancy, they provide information on health, they provide information on nutrition, services, programs, all of these resources that are available, which a lot of people aren't really aware of, that are available and are here that people can access in the city. So they provide that support, but they also get more information. Do you feel safe at home? Do you have enough food? Do you have transportation? Do you have concerns around your finances? So we have all these other services and programs in place to provide them with that support all the way through.
So how can folks get involved? Is this is a program that is available to a patient or any patients of Sisters?
Yes.
Right? Is there any other parameters or anything like that?
So because the grant we received through the American Rescue Act from through the city of Buffalo, it is specific to city of Buffalo residents for this particular program. However, if someone does not live in the city of Buffalo and they still need support, we're still going to help them. We're not going to say we're not going to help you, but we'll still give them guidance, give them support, give them the resources that they qualify for.
Very good.
Wonderful. A really wonderful expansion for Sisters. So thank you so much for coming on to share more about this program with us.
Absolutely. Thank you.
Thank you.